Hi, so this is Rachel and Elizabeth. We are here to talk about the project we've been working on this semester, Taste of the Week, and we are going to tell you a little bit about what we've done this semester.
So Taste of the Week is a partnership between the Nursing and Communities class at the MU Sinclair School of Nursing and the Boone's Lake Heartland YMCA in Booneville, Missouri. The program is in its fourth year, and it's funded by a CDC grant intended to help make healthier choices easier in Cooper and Howard counties. Our role specifically was to visit 5 local preschools and YMCA after-school classes and present information and samples of 1 fruit and 1 vegetable each week. We discussed important nutrients and their health value and exposed these children to some produce they might not otherwise get to experience.
So the CDC grant was obtained to help facilitate a more grassroots approach to community health promotion. According to CDC statistics, in 2012, around 17% of children and adolescents aged 2 to 19 were obese. In particular, obesity levels in preschool-age kids was higher among lower economic status families. Many of the kids that we encounter come from low-income families and don't always have access to fresh fruits and vegetables, especially in any wide variety. We want to instill a love of healthy foods from an early age to help influence food choices. A 2010 study showed that repeat exposure to certain vegetables can help children enjoy these foods more. Our program tries to provide one more exposure to some of these vegetables and fruits.
So our weekly schedules looked something like this. On Tuesday, we would go and purchase vegetables and fruits from grocery stores. We tried to pick fruits and vegetables that were in season so that the kids would get a good idea of how these taste at their best. We would then take the produce home, clean, and prepare taste-size pieces for 140 plus children. We would also prepare a lesson plan, including how these plants grow, the vitamins they contain, and why they're good for your body. We also incorporated information about food safety and preparation and different ways that people prepare and eat these foods. On Wednesday, we would visit the preschools starting at 8 a.m. This semester, we visited Emmanuel Lutheran Church, Imagination Station, Saints Peter and Paul Catholic School, Head Start, and 2 classes at Hannah Cole Primary. We then would teach 1 pre-K class, 1 first and second grade combined class, and 1 third through 6th grade class at the YMCA after-school program. During the course of the semester, we spotted a need for something supplemental to this program. We wanted the kids to have something to take home so that this teaching didn't stop in the classroom, and so that the parents would have some idea of what their kids were learning. We designed handouts for each lesson that included the fruit and vegetable of the week and a kid-friendly recipe that incorporated one of the week's foods. These can be kept by our preceptor and reused in later semesters as well.
So we felt like this project went well. We got good feedback from the teachers at each school, and the kids were enthusiastic participants every week. This wasn't a new project, so most of the schools were familiar with the program and had chosen to continue participating. The kid reactions were really what we were most concerned with. For the most part, we had positive feedback from the kids, and they started to show that they really understood repeated concepts such as what is a vitamin and the importance of washing foods before we eat them. On the topic of potential expansion of the project, we really thought that the older classes at the YMCA after-school program took to the information well. We think that expanding these presentations to include older classes at local elementary schools would be beneficial for continuing healthy food choices through childhood and adolescence. Some challenges we encountered were providing age-appropriate presentations of more complicated concepts. We learned quickly after the first week that glycemic index was definitely too complex, and what calories actually do in your body was a bit of a stretch. We both feel that this was good practice for learning to feel out your population for their level of health literacy and understanding in a real-time setting. This will help us as nurses in the future to actively evaluate our patients' understanding as we provide education, and hopefully this experience will help our population to make healthy eating choices through childhood, adolescence, and into adulthood.